what are some of the like treatment strategies that you use with your clients? See a lot about IV drips on your Instagram and love that. I know that we had kind of chatted about it, but would love to hear more about those or other sorts of protocols that you put your clients onto.
Yeah, so I use botanical medicine. So what we're trained in as a naturopathic doctor is botanical medicine. We're trained in nutrition. We are trained in IV therapy. We are trained in pharmaceutical drugs, so I can prescribe when I need to, certain medications. So I actually use LDN, low dose naltrexone, for autoimmunity for women, and that is it's a really small dose, but it does support autoimmune conditions. It's a medication, but it works. And then what else? I use IV therapy, and I've been doing some in-home IVs while everything's been closed up and people are, not feeling amazing at home. So the IVs, the reason why I love IVs, and I think that they do serve a purpose, is because of the prevalence of poor gut health. I mean, I would say that 75 to 80%, and maybe that's a underestimate, of people walking around on the street, if you just, took a group of people, they probably are not assimilating their nutrients as effectively as we want them to. So any food, any supplements, they're just not absorbing it well because of that one cell layer thick in the small intestine, what we call leaky gut, intestinal permeability. That is so common if you have had a period of chronic stress or, issues, other autoimmune issues. You can almost verify that you have leaky gut. And so we know that you're just not going to absorb 100% of anything that route. So when we give it IV, it goes straight into the bloodstream. You skip the liver metabolism. It goes straight into the cell, and people feel better fast. And that's really helpful in chronic GI issues. Anybody with Lyme, anybody with mycotoxin, they usually have some gut issues that go along with that. So they just don't absorb as well. So IVs help. Or even IM. So I give a lot of like intramuscular. We can do B12, we can do glutathione, we can do all other sorts of nutrients that way too.
Very cool. And super nice compliment, I think, to like the rest of the functional medicine approach stuff, because a lot of lifestyle changes, nutrition changes and stuff, it can just take a long time. So it's nice to know that you can still work with a naturopathic doctor and get this like immediate relief in some cases. So it's a good, nice little two-pronged approach there.
Absolutely. And the other thing that I haven't mentioned, so peptide therapy is another thing that I use in my practice that is, a lot of people don't know about that, but it's really amazing for a woman's health and hormone regulation. And so there's peptides essentially work to signal the body to help it do better at what it should be doing. It's just kind of lost its way or it's confused. So there's certain peptides that I use in autoimmunity. There's one called thymosin alpha. It's phenomenal for autoimmunity. And it essentially helps to re-regulate the immune system. So it improves Treg cells, which are off in autoimmunity. And it really, I call it like an immune system reset back to what your immune system was when you were young. And so we know that women, when they turn 30, around the age of 30, their thymus gland involutes. They don't make those thymus peptides, which regulate your immune system. And so that's maybe one of the reasons why autoimmunity increases in women after the age of 30. Yeah. And so we can use peptides, we can use certain things that are in the scope of natural medicine to help re-regulate the body and just help it to do better at what it knows how to do.